The country works to keep the overall death toll down as far as possible. Well, the battle against the virus has reached a new milestone. The U.S. Army opening its first ever field hospital in New York City, first in memory anyway. Only on CBS this morning, we went inside that new hospital at the Javits Convention Center with Army Chief of Staff General James McConville. He says that what the Army learns in New York could be a model for the whole nation.
We will win, right? Winning matters. Defeat the virus.
General James McConville has seen heroism before as a veteran of the wars in Iraq and Afghanistan.
We're in a war against an invisible threat, right?
But the fight against COVID-19 is unlike any other in his long career.
It's kind of interesting when you take a look at it. The heroes in this fight are going to be the doctors, the nurses, the scientists, and the medical professionals.
We have 2 hospital centers that are here.
We met up with the general as he got a final briefing and tour of the new Javits medical station.
And we are no strangers to coming out and doing response.
It's designed to handle non-COVID-19 patients, freeing existing New York hospitals to expand their fight against the virus.
We are able to manage patients from routine all the way to the most severe, depending on the equipment that we have.
Sure.
So
McConville says the playbook could be used nationwide.
Army Corps engineers are in every single state. They are working with the state and local officials. They've done 181 assessments of pre-existing facilities like this so we can rapidly stand up hospitals, and we're working with FEMA, and FEMA is the one that's providing all these type of equipment.
Did you say 181 assessments?
Yes, we've
Wow.
done 181 assessments of pre-existing structures. Some are arenas, some are hotels, and the intent is to quickly turn them into some type of healthcare facilities to give the states options, to give them additional capacity in their states.
But with half of its field hospitals now dedicated to the fight against COVID-19, the Army could soon face staffing shortages of its own.
How do you staff these hospitals to fight COVID while maintaining the Army's capability for the outbreak of war?
Well, we do it with very careful management. We're managing risk. We know what we have. We know what we have available.
Would that be calling up volunteers, new recruits?
Well, we have. We have called up volunteers, but we have in the regular Army right now what we need to protect the nation and defeat anyone that wishes us harm.
The hospitals are part of a wider U.S. military effort to beat back the virus.
So the Army is providing medical support, logistics planning, vaccine research.
Right.
If things become severe, can you foresee a future where the Army is enforcing a possible quarantine?
I don't think so. I mean, what I see is the Army is here to protect the nation, not to police the nation. We don't have that type of order. We have not been asked to plan for those type things, and so I wouldn't say that is so.
This is a place that's literally going to save lives.
Starting today, this hospital can help save about 1,000 lives at a time.
So by next week, you have 3,000 beds?
Yes, sir.
It's pretty incredible.
McConville says the Army is here for the long haul.
The Army's vision or mission is any adversary, anywhere, anytime.
That's right.
I guess you do mean any.
That's right. We're here to protect the nation, and right now, as the President said, our nation is threatened by this invisible enemy, this virus, and we will defeat it.
And it's hard not to believe him there. There are nearly 600 active duty medical personnel and support staff at that medical station. They are working with more than 350 medics and nurses. Now consider this, the Army is officially a resource of last resort. It's used only after city, county, state, and civilian federal resources have been exhausted. So this is truly a major milestone, Anthony. And many of the medical personnel there have dealt with combat injuries, but they say it's no different treating civilian injuries. Medicine is medicine, and they're some of the best in the world at it.
Yeah, and we're really glad that they're there for us right now. We need them, certainly here in this city.